Alrighty, let's get into some cupping. So, I brought a couple different cupping tools with me. So I do have the silicone cups. I have 3 of my glass cup sets, different sizes, so I can work on different areas of the face. I'm going to show you guys with the silicone cups the best technique to use. I don't recommend them in treatment. I find they don't give a great result. They are awesome for home use, even for yourself, but clinically I find the glass to be superior for results. So I would definitely advise that. Pinching as low as you can on the cup, always that two-handed approach. There we go. I need you guys to see my hands. Two-handed approach, squeeze, apply, release the hand, and begin gliding, okay? You want there to be suction with the cup while you are gliding. Squeeze, squeeze, release, okay? So that should happen. Intermittent cupping is squeeze, squeeze, squeeze. So we have pump, release, pump, release, pump, release. That's intermittent cupping. That one to stimulate areas of lines and congestion and key drainage locations, okay? And on the neck as well, because we do not do any gliding over the neck, just pumping, okay? We can come both up and down with our pumping, but we always want to make sure that we are not gliding across the neck, forcing the change of fluid flow, rather encouraging that which we can encourage to move in the right directions. Alrighty. Let's see what happens here, my friends. So I'm gonna work the glass cup first. I'm gonna work with this nice rectangular sort of styling. We're gonna sweep from the middle of the chest. The slower we go, the more fluid we're going to drain. Squeeze, release. When my hand's grabbing the tool, you can see that I'm shaking hands with my tool, squeezing. My fingers are dropping down and they're gonna pull that glass along the skin. I'm not pulling from the blue veil. So squeeze, apply, and move the cup on the glass. Okay. In each area, we have about 9 sweeps. We have 3 different tracks, so under, on, and over each bone. Oops, that was not the noise you want to hear. That noise meant that I did not squeeze to release the tool. It can happen on areas where there is a curve or there is maybe hair gets in the way, especially in treating a man with sideburns. So be aware of sort of your positioning on the skin. If you keep your elbows wide and your stance wide around your clients, you'll have better range of motion with your wrist to be able to combat those curves. Make it sound like it's a war zone out there. Oh man. And then above the collarbone. Cupping should be fairly silent if done correctly. Fantastic. And we're going to open up terminus, just doing some pumps in this area. Cupping is a stimulating therapy. We're bringing in blood flow and nutrients. So be reminded of that as we venture into this space. And then I'm just going to begin to do some intermittent cupping down the neck in 3 positions. Reminding ourselves that if these are my 3 positions, okay, that I'm going to take on the skin, if my client is getting very red while I'm beginning my first section, I have the opportunity to do 1, 2, 3, 1, 2, 3, 1, 2, 3, or 1, 2, 3, 1, 2, 3, 1, 2, 3. So less tissue relaxation time in the second way. But we have the opportunity to give the tissues more chance to relax if we're nervous about the amount of stimulation that we see. Also, too, if the client is a new client and you're not aware of their skin, always work on the side of caution. You can always increase and go over things afterwards, but you never want to leave someone with the stimulation or the Sha on the skin. Right now we're opening up all the channels for drainage. creating space in the skin. The negative pressure of cupping allows the skin to have space. It makes a great treatment to do before gua sha. Great, so I'm gonna go back to my client's face now. Let's spend some time focusing on areas of concern. So perhaps I'm gonna begin to work around marionette lines, plumping here, working around the perimeter of the lips. This pumping action. Okay, sorry, my hand was blocking there. Isolabial folds. Fine lines around the eyes, so that means that I didn't have good suction on the edges of the cup. Okay, the 11s. And the lines across the forehead, beautiful lines of expression. Okay, now we're going to begin. We've already opened up the chest. We've opened up the neck for drainage. We're going to begin under the chin. So you may have to position your client's chin so that you get a better stretch on the belly of the submandibular space. And beginning on the track closest to the neck, sweeping back towards the ear. Squeeze, stretch. Be sure that you're always having two hands on the client. It bothers me a lot to see that there's technique videos being shared online and they're not stretching the tissues and supporting them. Not every client will have 3 spaces under their chin, but do as many tracks as you have available to you. Okay, always beginning with slower passes and quickly increasing over those 3 phases. Now going on the mandible, I probably won't get it with my oblong tool, so why don't we take a look at this guy here. Going on the mandible. Ooh, felt good. Squeeze. Moving up into our second position. Now, if we feel like there's a lot of tension here, I may do a little bit of pumping. Creating more space. Once I've cleared the mandible on this last track, I'm going to begin drainage. Excellent, so I finished that mandible. And now I can begin clearing the cheek. ensuring that my hand, okay, is following the contour of the face. We mentioned it earlier when we talked about the shoulder. However, we want to make sure that we're following with our wrist that contour of the face with the elbow high. At home, it'll allow you to do that. On the screen for me, it means I'm blocking your view. But if not, you're just going to work in this plane and it comes off the skin. You'll end up with a beautiful little hickey there. Plumping the eye. Lifting and sculpting the eye and that lateral aspect of the cheek, that full lift that can happen here. Watch when I pull here, tuck. It's a good spot for a little face tuck, face lift. And clearing out the congestion and puffiness here with some intermittent cupping on that orbital ridge. Excellent. We can begin to work on the brow bone, so above the eye here, and then we'll do a little drain. So we're gonna go underneath, it should be your smallest size cup, which I think ours broke, so I'm gonna do my best to get all of this in here for you guys. It will probably and very likely skip over hair, so be aware of that. It's not getting great section, but we'll do our best. Okay, and now we're gonna drain. Beautiful. And we'll finish our sequence on the forehead. So we'll work from the medial aspect, stretching up and straight back. Beautiful way to get a brow lift. Place the cup here, allow it to fill and stretch the skin back. And the McDonald's arches coming around medially to laterally to the temporalis and draining. Beautiful. You can do one final sweep from the chest, the neck, under the jaw, one on every track, over the eyes, the forehead, and then one final drainage sweep all the way down, and you finished your cupping treatment.